The national state of disaster, Gareth, it's officially over after more than 700 days. President Cyril Ramaphosa made that announcement just last night. The COVID-19 pandemic will now be managed through the National Health Act. So for some more reaction to this, we're joined by health expert Dr Fundile Nyati. Dr. Nyati, always a pleasure talking to you. Good morning. And long overdue, do you think? It seems that we're hearing from restaurateurs that this is a relief, I suppose, for industry as well.
Well, I think it's excellent news. A number of business sectors were hit hard by the regulations that go with the national state of disaster. My heart goes to them for all the losses that they suffered. So the announcement yesterday must have been very much welcomed. But on the other hand, one must be able to say as well that, the reason for the state of disaster was an extraordinary, threat to lives, which the government could not ignore. It was a health crisis globally, and we needed to do something about it and to coordinate the interventions you needed and act like that. So it's painful for people who have lost on the livelihood side, but on the other hand, lives have been saved. So we need to balance when we look at it.
Absolutely. The president also mentioned last night that we have entered a new phase of the pandemic. What work do you think lies ahead now? What's the work, role and responsibility of both the National Health Act as well as ordinary South Africans in ensuring that we keep each other safe?
I think, let me start with the ordinary South Africans. As South Africans, already by around December, people were fatigued by all these regulations. And then, at the beginning, we thought by the end of 2020, this pandemic would be gone. But a year later, still not gone, and it is there even now. But what needs to happen is that we now need to take personal responsibility as individuals. The government is basically saying we've done that which we could. We will continue to monitor things, but it's really up to you, the decisions, the choices that you make. This thing is not gone. In other countries, like, for example, in China, where it started, there's a serious problem now. There's a level 5 lockdown in China. In the UK, they've got problems. In Sweden, they've got problems. In New Zealand, where they never had COVID-19, it's a problem. So the numbers are growing. So it's not out, of our lives, but we should, by 2 years, have learned how to try and protect ourselves and our loved ones. And that's what the government is saying, guys, go back to as near normality as possible, but be aware this problem is still there.
And the National Health Act?
Well, again, instead of just, stopping the national disaster, under the Disaster Management Act 57 of 2002, what they are saying is there will still be a need for us to coordinate, this thing. Yeah. But let's now move on to the National Health Act and deal with this under the regulations of notifiable diseases, which not only deal with COVID, but any disease that's notifiable, whether it is Ebola, whether it is TB, whether it is typhoid, whatever that's notifiable, because we still need to keep statistics and monitor from an epidemiological point of view, and also be able to report to WHO what is happening. So that is why there is a public comment period up until the 16th of April, and I hope South Africans will make use of that and not wait and complain thereafter. Yeah. So that once they promulgate the new regulations under the National Health Act, then it will be something that we know we have contributed towards rather than us complaining. So it's a responsible thing to do, but at the same time, we need to give people their lives back by minimizing, any regulations that interfere with their daily lives. So only masking in the indoors, the gatherings, and also those who are traveling, coming into our country. Otherwise, everything else, no more social distancing, no more need to sanitize, and all of that. So all of the things we've grown accustomed to, which we loved to hate, they are now going. So I think let's now focus our attention as South Africans and contribute to the public comment on the regulations, and it's available, in the website of the National Department of Health.
And Doc, speaking of things we loved to hate about the national state of disaster, I want to take it back and reflect back on some of the criticism that, government had received. I mean, they were accused of, implementing nonsensical, what some called nonsensical regulations. I'm talking here about the open-toed shoes. There was once upon a time you and I couldn't wear those shoes.
Yes.
There was a time we couldn't buy cooked chicken from Woolies, for example. And I mean, the president still defended the national state of disaster, saying, and I quote, "No doubt such a response was still necessary." Any lessons you think there have been learned by government, or do you think we're just too hard on a government that was dealing with something new for the first time?
Well, I think we need to move from that base that something like this has not happened since 1918 to 1920, and most of us were not there. We were not even an idea by that time.
Yeah.
So it was a learning process for everybody. They put together, a number of experts to try and, bring some order and rationality. But indeed, some of the regulations did not make sense. But I'm happy that over time, those fell through. Even on what is happening now, certain things don't still make sense. For example, we are told that there should be no isolation, in the South African context, no isolation if you don't have symptoms. And isolation period is 7 days. But on what was announced yesterday, if a person coming from outside of the country comes in, there's a 10-day isolation period.
Right.
Why the difference? And because it should be based on whether they've got symptoms or no symptoms. So, so there is still a few mistakes that I think are being made, and I think we shouldn't be doing that. So, yes, there's been lessons, but there will still be lessons going forward. And let's comment on those, draft regulations so that we can refine the process. It's a two-way process, citizens and government working together.
I couldn't agree more there with you, and I appreciate you speaking to me, Dr. Fundile Nyati. Always a pleasure talking to you and joining us right here on the South African Morning.